Well, good afternoon, everybody. It's close to 2:20. We are at section 6, the last section of, after about 12 hours of concentrated information. And I think we are starting to create what I would call close to a burning platform, because we've started to hear about policy-related stuff already before we started in this session, which is wonderful. I want to make a few comments before I introduce our panel and speakers. So the section is titled Policy Solutions, and I would be remiss if I say that what the session will likely do or attempt to do will be to bring some policy questions forth, offer some reflections, receive some comments and input, and explore some initial solutions, rather than provide solutions right off the bat. In the interest of looking at it, I always try to look at the definition of the words that are part of the session, and I looked at policy and tried to tease out one or two salient words out of those definitions. So, for example, a policy or a public policy or a health and environment policy could be defined as a vision for the future, outlining priorities, expected roles of the stakeholders and groups. It also includes building consensus and informing people or public. So underscore the word informing people or public, because I think that's something that we need to maybe talk a little bit more about, and we've heard some of it already. The other piece of the classic definition of the policy would be, it is a commitment of an organization, a state, whatever, to laws, regulations, and underscore the next two words, other mechanisms. So not just laws and regulations, but other mechanisms in addition to laws and regulations concerning whatever the topic, in this case, environmental health. So a couple of other comments. One, what a novel fortuitous coincidence that this is 50 years of the publication of the Austin Bradford Hill essay that came out in the Proceedings of the Royal College of Medicine in 1965, aptly named Frank, The Environment and Disease, Association or Causation. I think many of you in epidemiology recognize that. And today, a lot of this discussion has been around associations or causations. And so I thought it'd be wonderful to mention that here today. A few key words that I picked up, and I think we have all heard more than multiple times: susceptibility, associations, gender variation, single versus multiple, timing of exposure, time of response, dose, low dose versus high dose versus medium dose, cause versus effect, etc., etc., and the story goes on. So last night after dinner, a wonderful dinner, when I went back to my room, I said, this is multifactorial and complex, but these two words don't do justice to the problem that we've been talking about. So I could not get away from multifactorial, because that is indeed a fact of life in this situation. But I think each factor is also multifaceted. So we do have multiple factors, but each factor is also multifaceted, just like as I gave you some example. And therefore, this this issue becomes multifarious. So the three M's, Frank is smiling there, so it is multifactorial, it is multifaceted, and it is multifarious. And therefore, where we are, and we are going into the policy session, so we need to think about it from that background to move into the policy sessions. I think Lynn has done a fantastic job of saying something that I wrote down was, for policies, typically we start with saying, do we have sufficient and clear evidence, right? The question is, do we need sufficient and clear evidence before we take the next step, or would it be too late? And how would we do that is the actual question. So now I have the privilege of introducing the speakers and the panelists. Our first discussant is Jean Connery, who's going to be joining us by phone. Dr. Connery is the Assistant Physician-in-Chief at Kaiser Permanente. She is the Associate Clinical Professor of OB-GYN at UC Davis. She is here representing the American Congress of Obstetricians and Gynecologists, where she introduced an agenda on reproductive health and environment. Very pertinent. Our second discussant, who is also joining by phone and regrets not being here, is Judy LeKind. She is the president of LeKind Associates and an adjunct associate professor of epidemiology and public health at the University of Maryland School of Medicine. She is an environmental health scientist with expertise in exposure science monitoring. Our third presenter is Sheila Satyanarayana, associate professor of pediatrics, Department of Environmental and Occupational Health Sciences at the University of Washington. She serves currently as the chair for the U.S. EPA Children's Health Protection Advisory Committee, and she's here representing American Academy of Pediatrics. Our next presenter is Sonia Lunder. She's a senior analyst at the Environmental Working Group. Previously, she has managed community health interventions and Superfund sites, so she brings some practical, pragmatic, different stakeholder perspective in this. And she has worked on various focus groups on chemicals in food, water, air, and consumer products. So with that, let's go to our first presenter, Jean Conry. We have about 5 to 6 minutes of presentation followed by the panel discussion. So